will be the adoption of the BRRR reports, the minutes, and the report on the program. Maybe let me start with the report on the program. Honorable members, I'm generally wanting to start by apologizing to the committee. I think we underestimated the amount of work that needs to be done on the program. The knock-on effect on the program, and the fact that we have realized that as we are going through the program, that certain things we did not anticipate them. For an example, that Parliament adjourns on the 26th of March, and I think the last adoption was going to be around that time, and we also have to observe the 3-day rule before the bill is debated in the House. So we are reworking the whole program to ensure that there is enough time between the time we finish, hopefully with the 3 bills, and the time it is allowed in terms of the rules for the to observe the other that is the 3-day rule to allow a proper adoption of the bill. So we are really begging for your indulgence that we present the total revised program on Wednesday, because on Tuesday it will be the subcommittee meeting. So at the next meeting we will have it on Wednesday. So the reworking of the program, it's still a work in progress. Is that agreeable, members?
Yes, thank you.
Thank you very much. Thank you very much, Honorable Breitenbach. Honorable members, I think let's start with the adoption or the processing of the BRRRs. Let us start with let me check. Maybe let's start with Correctional Services. The reports were circulated some time back, so I propose that they should be taken as read, but we are bound that we must go through page by page to see if there are any corrections before we move or somebody moves for the adoption. Is that in order, members?
In order, morning, Chair.
Yes,
in order.
Yes, Chair.
Thank you very much, and welcome, Honorable Swart, Honorable Breitenbach. So let's start with the budgetary review and recommendation report of the Portfolio Committee on Justice and Correctional Services, dated February 2020. Are there any corrections on page 1?
Sorry, Chair, there's a hand of Honorable Self.
Okay, let me because I am using my. In fact, I can't see members. I think it will be better, members, just to raise your voice, and I'll be able to note you. Honorable Self.
Thank you, Chairperson. I'm a little bit hesitant to go page by page because I think there is a overall problem with the report. And the overall problem with the report concerns the credibility of the measurements that are supplied by the Department of Correctional Services. We are quoting their achievements against their audit outcomes, but we just accept their word for it. And rather than go page by page, could we consider for 1 minute that particular problem, because I think there's a way out of it without compromising the committee or the committee's report.
Okay.
May I continue?
Yeah, maybe you need to proceed. Can you raise your point so that maybe we see and see your recommendation?
Thank you. Well, I just want to give 3 illustrations of what I mean. And that is on table 3 at the top of page 8. There is a statistic supplied by the department of the percentage of officials charged and found guilty of corrupt activities, which is quoted as 97%.
Sorry, Honourable Self, Honourable Wilma, and Chair, just to interject quickly, my apologies. I'm very sorry, Honourable Self. My iPad doesn't show the page numbers, but can you maybe just say which points? Is it 1.1, 2.2, or which, so that it's easier for me to just look under which point it is, please.
I'll try and do that. I'll try. But then later on in the report, under paragraph 4.8, it's recorded that the Auditor General could not obtain sufficient appropriate information about the number of disciplinary offences under consequence management. Then on page 10, and I'm sorry I haven't got the paragraph number, there's a percentage of offenders participating in skills development programs measured against the number of offenders enrolled, which is between 97 and 99%. I just don't believe that figure. It's just inconceivable unless the skills development program is measured against the numbers of offenders actually participating or actually signed up for those particular courses. And then in paragraph 11.10, the committee correctly makes the point that they doubt the capacity of the Community Corrections branch to monitor parolees and probationers entrusted to their care. Yet on page 12, there's a performance figure of parolees and probationers without violations of 99%. So you will see, Chairperson, that I'm not sure whether the department is providing accurate figures, and we are, in a sense, endorsing those figures. And my suggestion is that the committee report be changed to say that that they note the reported figures of the department rather than accepting them as being correct.
And thank you very much, Honourable Sel. I think firstly we will have to give to this content advisor to respond. But I do think that maybe we would have to go back to your suggestion. But I do think that it would be important that we, having taken note of what we have raised, but we do have to, as a matter of procedure, go page by page. And I do think that we will, as a weighty issue at the end, deal with what we have raised and we resolve on it. Is that fine, Honourable Sir?
That's absolutely perfect, Chairperson. Thank you.
Thank you very much. I think at the end of us dealing page by page, then the committee, sorry, I'm used to committee secretary, then the content advisor, Mr. Matabate, would respond to the issue raised by Honourable Sir. But I think we will have as a committee say what do we do and say what do we do with the recommendations made by Honourable Sir, which I think it does to a certain extent take us forward. Let's first start with the page by page. page 1. Page 2.
Chairperson, and
Honorable Juan.
yes, on page 2, both paragraphs 2.4 and 2.5 need a full stop at the end of the paragraph or the sentence.
Okay. Thank you very much, Honorable Juan.
Chairperson,
Honorable Self.
yes, may I draw your attention to paragraph 2.1?
Yes.
At the last stage of that, it says that the tabling of annual reports by departments into Parliament, which are usually tabled by 31 September. September doesn't have 31 days. But I would suggest that annual reports of departments to Parliament, which are usually tabled by 30 September each year.
Yes. Thank you very much, Honorable Self.
And then, Chairperson, on paragraph 2.2, on 7 October 2019, I think that must be 2020.
Yes. Thank you very much. Thank you very much. Okay, on 2.2, 2.3, page 3.
Yes, Chairperson.
Honorable Self.
Yeah, I think in paragraph 4.1, it says the department received a qualified audit outcome for 2019-2020, as has been the case since 2016-17. I think the qualified audits go back much further than that. In fact, I'm not sure whether they don't go back until the early 2000s. I'd just like the content advisor perhaps to just check that.
Thank you very much, Honorable Sir. Can the content advisor double check that and come back to us before we adopt the report? Okay, page 4, page 3, page 4.
Chairperson,
Honorable Juan.
once again, paragraph 4.3 need a full stop at the end of it.
Thank you very much. Thank you very much. Page 4. Page 5. Page 5. Page 6. Page 6. Page 7. Page 8. Page 9.
Chairperson,
Honorable Juan.
they're on page 9, and there's a further, if I can go just back to page 9 there. There's talk of sub-programs, but the sub-programs is spelled with a P instead of a B. I think it's just, sorry, it might even be page 8 there. Yes, 8.2.2.
Yes.
It is also repeated later on page 11 at 841. But if you wish, I can draw your attention to that again.
Okay. Thank you very much. That should be corrected.
And I think sub-programs are either hyphenated or two words. Yes.
I think as part of cleaning up, these are the things that you content advisor, you should go through them and correct all of them and do quality check again. Okay, page 9. Page 10. Page 11. Page 12.
Sorry, Chair.
Honorable Horn.
In 851 there is a offenders there at the end of the first line. It should be the S before the indication that it is plural, just
Okay.
grammatically. Yes, thank you.
Thank you very much, Honorable Horn. Page 12. Page 13. Page 14. Page 15.
Chairperson.
Yes, Honorable Self.
It's Honorable Horn.
Sorry.
No, it's fine. 1032. There's also a grammatical error in the way centers is referred to. On page 15.
Page 15. 10.2.
Yeah, I think what I was thinking there in 1032 and 1031, we talk about correctional facilities, but generally the term is correctional centers. Oh, yes. And there in 1032 centers, in the fourth line, yes, there where the marker is now, is it shouldn't have the apostrophe.
Remove the apostrophe.
No, yeah, no, it should. Yeah, no, I think it's correct there. I think what I wanted to replace facilities with centers. Thank you.
Okay, let's go down page 16, page 17.
Chair, on page 17, there is a reference in the last sentence of 1036. Or there is a sentence that reads again majority of at the end of 1036. I think it goes on to page 17. It says again majority of, it should be the. Yeah, thank you.
Thank you very much. Page 17. Okay. I think we was 27. Page 17, page 18. Page 19. Page 20.
Chairperson, paragraph 11.6 on page 20 says the committee is not happy. May I just propose that we relook at the not happy part? I don't think it is the best use of professional language.
He's not satisfied.
Yeah, thank you.
Not convinced.
Yes, not satisfied with more.
But is dissatisfied.
Dissatisfied.
Welcome, Honorable Yago.
Thank you. Thank you, Chair.
Okay, page 21.
Chair,
Honorable Swart.
11.10. I'm a member of the committee. I'm not disturbed. 11.10. The committee is disturbed. I think concerned. Thank you.
Thank you. Page 22.
Chairperson?
Honorable.
Yes, there in 11.12, the last sentence should read achieved all targets.
11.12.
Yeah. Notes that
Which sentence is that?
Yeah, what I wanted to say is I think that's sort of contradictory in nature.
It's 11.12, Honorable Hon.
Yes, it says on in the first sentence the department achieved all targets, and then the very next sentence says the committee also notes with concern that as the first quarter the target viral load was not achieved. So I think we must decide what is the situation.
Yes, with respect, Chairperson, that's entirely my point, that the department reports certain things, but they're not necessarily correct.
Content advisor.
Chair, I think on 11.12, we are talking about firstly the first two lines. It's for the financial year 2019-20, and the next line we're talking about the first quarter of 2020-21. Maybe the committee might propose that we separate the 2020 information and 2021 information on that paragraph, because it's two issues there. In the 2019-20 financial year, they've achieved, but then now we're concerned that in the first quarter of 2020 and 2021, they didn't achieve that specific target.
The issue is that the department achieved all targets under care program in 2019-2020. The veracity of that, I think that is what is the concern. What do you say about it? The veracity of the figures under care program.
Chair, Wilma.
Yes, Honorable Dragan.
My apologies, sorry to interject, Chair. Can, after the first line, of 2019-20 financial year, then full stop, and then on a new line say, however, comma, the committee also notes that in the first quarter of 2021, the new year. So maybe just start, say however, and then the rest of the sentence.
Okay. Okay. Can you correct Honorable Sort?
No, I agree with that, with the proposal.
Okay.
1114 is again to replace not happy with the words dissatisfied. 11.14.
Yes, 11.1.4. Okay. Page 23. Page 23.
Sorry, Chair, to go back.
Okay, Honorable Swart.
11.15, I think the committee is also seriously disturbed. I'm not sure that's correct. Maybe I can seriously disturbed.
Maybe seriously concerned.
Yeah, deeply concerned, seriously concerned. That's fine, either. Deeply concerned, just to use a different word.
Yes. Okay, page 23. Page 24. Page 25. Page 26.
Chair, on page 26, 1212, there should be a space after targets. I don't know whether that has been, yeah, I think it's been corrected already.
Okay, thank you very much. Page 26, page 27. Thank you very much. Honorable members, let's go back to the issues raised by Honorable Self.
Chairperson,
Honorable Self.
may I make a suggestion in order to try and deal with this matter?
Yes.
On paragraph 11.6 on page 20, I think it is.
Page 20.
11.6, yeah. I would suggest that in as neutral a way as possible, adding the following sentence somewhere in that paragraph, that the committee does not have the means to verify the accuracy of the achievement of targets by the department. Because that would, in a sense, without saying that they're wrong, right or wrong, we just don't know whether they're right or wrong. I personally doubt that they're right, but that's not the point. I think that we must just say that we don't have the means to verify them.
Okay. What are the views of other members?
I agree with the proposal, Chair. It does qualify the report in that regard. So I would suggest that we insert that caveat under 11.6.
Chair, I also support that proposal. I think that would sufficiently deal with the matter.
Other views? So I take it that that
Yeah,
is
we agree, Chair.
okay. Thank you very much. Can we include that one, that caveat?
And then Chair Steve here, I have just one, I missed one proposal once we've dealt with this. I'm sorry to take you back. It's a very quick, along the lines of Honourable Horn. It's an important full stop.
Okay. Which page is that?
It's on page 15. Once we finish this, sorry.
Page 15.
Point 10.2.1. There is, at that last figure, it says 67,158,3.8.87 million. I think the full stop must be removed to after the 67, because it's 67.158 million. Otherwise, it would, and that was my understanding of that figure.
Okay.
Thank you.
Thank you very much. Honorable Mufuka.
On 11.19, the last part of it, it says the committee has, however, expressed its unhappiness. I think it goes with what the Honorable Horn was saying, that we remove unhappiness but concern.
Yes.
Thank you.
I'm happy with that, Chair.
Yes. Thank you very much. Now, having corrected the report, is there any mover for the adoption of the report as corrected?
Chairperson, with all the corrections, Chairperson, I move for adoption of this report. Thank you.
Honorable Jelle moves for the adoption of the report. Is there any seconder?
I second, Chair. Thank you.
Honorable Mfuken seconds. Is there any objection?
Chair.
Honorable Liako.
Thank you very much, Chair. As you know, I do report to a caucus and I'm an alternate in this committee, but I do know at face value that we will probably reject this BRRR report. Thank you.
EFF rejects, or let me correctly.
I think it's okay to say reject.
Okay, so I was going to say you reserve your position, so you're comfortable with reject.
Or provisionally reject, if there's such a thing.
No, let's say you reserve your position because it does not bind you. You can either reject it in the House or agree with it. So it gives you space to move, to maneuver.
Thank you. All right. Thank you very much.
Thank you very much.
Chairperson, will you please also note that the DA reserves its position?
Yes, the DA reserves its position.
And the ACDP, thank you, Chair.
And the ACDP. The report of Correctional Services, it's agreed to. Let's move to the next report. Let's move to the report of Justice and Correctional Services. Can you take out the slide? Committee Secretary, can you take out the slide and put the Justice slide? I must warn the members in advance, this is a 91-page document.
Chairperson, I'm sharing my screen, so I just want to double check if you can see the Justice report.
No, this one has not yet been removed, so I can't see the Justice report.
Oh, yeah, because on my screen I've got the Justice report.
Sorry, Chair, can I assist? I'm Chris. Just unshare quickly, then you
okay.
start fresh.
Okay. That one.
Yeah.
Perfect. Sorry about that.
No problem. Yes, it's 91 pages. Is the budgetary review and recommendation report of the Portfolio Committee on Justice and Correctional Services dated 19 February 2021. Are there any corrections on page 1? On page 2?
Chair, there on page 2, paragraph 1.6.
Yes, 1.6.
The cannot, in my view, is not the correct tense. I think it should read could not.
Yes.
Thank you.
Thank you very much, Honorable Horn. Page 2. Page 3. Page 4. Page 4. Page 5. Page 6. Page 7. Page 8. Page 9. Page 10. Page 11. Page 12. Page 13. Page 14.
Chairperson,
Okay.
I think on mine is page 12 on the commencement of POPIA. It says that the committee felt frustrated. I don't think I'm frustrated, but I'm concerned.
Yes.
Thank you.
Let's put the word concern. Okay, it's page 14. Page 15. Page 16. Page 17. Page 18. Page 19. Page 20.
Chairperson,
Honorable Horn.
There from the quality of submitted reports onwards in that column or on those columns, it seems to me from there onwards that the left and the right or the right-hand column is just a duplication every time of what is said in the left-hand column. I don't know. So there's a number. It's just repeated or duplicated there up to that point of payment of invoices again, if you look at it. I don't know whether there was just a technical glitch of sorts.
No, those were repeat findings.
Oh, I see.
So you are fine, Honorable Horn.
Yeah, no, if we get that assurance, it's fine.
Thank you very much. We're on page 20, 21. Twenty-two. 23. 24. 25. 26. 27. 28.
Sorry, Chair, there at 732.
732.
The spacing after most concerning before the comma, there is just a technical improvement that needs to happen.
7, 2. Okay. 28. 29. 30. 51. 32. 32. 33. 34. 35. 36. 37. 38. 39. 40. 41. 42. 43. 44, 45, 46, 47, 48, 49.
Chairperson,
Honorable Hon.
on page 49, 10, 13, 2. Talks about pending budget cut, which I think should rather read budget cuts.
Yes. Thank you very much. 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78.
Chairperson?
Honorable Juan,
Yeah,
77.
1410. It is so that none of what is captured there is incorrect. But I just have this feeling that that second sentence there, while the appointment of the chief master is a step in the right direction, the committee is of view that much more will need to be done to address the problem, is that if possible, we can add, because I think that was also I want to say a understanding of the committee, that we would at the soonest opportunity possible would like to receive a report on the progress in the improvement of both the management of masters' offices and the service delivery there.
No, Honorable Horn, I think you are quite right, because I remember when we agreed on the presentation to the committee of the Solicitor General, it was also end of the Chief Master. So you are quite right. In fact,
Yes, thank you, Chair.
When we come back, it should be one of our priorities because that office is in a state of mess.
Well, as it is, Chair, it's the one entity or department in respect of whose services I get complaints on a weekly basis, and I expect other members as well.
I think all of us, and if you remember, when Honorable Mohammed died, he was from that office. He was complaining bitterly about the state of disarray in that office. So when we come back, it should be one of our priorities, that we get a thorough briefing, and we should really prioritize that committee, like the way we are prioritizing SIU, NPA reports on that issue of the State Attorney's Office. We should be getting periodical briefings with regard to that office. It's one entity that is going to be, or branch that is going to be a blot on our work. So can we go to 78?
Sorry, Chair. Can we go to 14.1.2?
14.1.2. 14.1.2.
Yes, please. Yes, it says that the committee observes that a commitment leadership, I think we know we cannot observe because then it means that we can't do anything. Why committee observes? Can we get guidance on that?
Ms. Silkstone?
It's really an observation that the committee is making that with committed leadership and allocation of more resources, the MPA there's a change that is happening within the MPA. But if you're not happy with that, we can just say the committee acknowledges, or we note that a committed leadership and allocation of more resources has begun to make a difference.
Acknowledges is better. Thank you.
Okay.
Acknowledges that.
Chair, may I ask, doesn't acknowledge mean that you are committing yourself to the fact that a committed leadership, wouldn't you rather just note?
Yeah,
because
Yes.
acknowledge is almost the same to me as committing to the fact that a committed leadership, or I don't know.
My understanding when we went through that process is that we did acknowledge that with the leadership that is being displayed now, there is a difference that we are seeing. It is an observation on what we observed when they appeared before us, and two subsequent appearance before us before that.
But you see then, Chair, you're then observing, which is acknowledging, is the same, it's a thesaurus. You might as well note it.
It will be up to the members to which terminology, because this will reflect the committee's observations. It will be ultimately up to the members. What do the members say?
Maybe the English people can give us a guidance on that. But for me, observes, acknowledge, it's the same word. It's just a different way of writing it
Which means it shouldn't.
than to note it, because noting it doesn't bind you to anything. You've noted that a committed leadership and allocation of resources. You're not acknowledging, which is to bind yourself to it.
What is the view of other members?
Chair,
Honorable Mfuke?
when I raised it, actually, my first point was to note, noted that. But if we also acknowledge that at a commitment leadership, the allocation of more resources, we acknowledge what they said, and what we have seen. But I don't know if now there's a problem about acknowledgement, acknowledge or noted or committed. So can we be assisted on this?
May I ask that we note it?
Wilma?
Honorable Trachen?
Thank you very much, Chair. I would prefer the use of the word noted, because it was a presentation that was given to us. So, we noted the presentation and what came after. So I would prefer that usage. Thank you, Chair.
Chair,
Honorable Mfuke, do you have any objection to the word noting?
Chair, give first to Honorable Matemba, I think wants to make an input first.
Chair, are you giving me that opportunity?
I'm trying to manage time because I
Okay.
do not want a situation where we spend a lot of time on something where we are not really differing.
No, Chair, I'm just supporting that view because Honorable Mufukeng did not disagree on the issue of noting. So I was just saying, can we pass that one and just note? No. Thank you, Chair.
Can we accept the noting part, that we include the word noting?
Yes, let's note.
And it's note, okay, let's proceed. Page, I think 178 that time.
Master
78.
Okay, yeah, 70. Here we are.
79, 80, 81, 82, 83, 84. Sorry, honorable members, when I was going through this report, I'm not sure where it is, but where we talk about Public Service Commission, I think we should put a time frame. I think they should report to the House, they should report to the House when we do the BRRRs, the next phase of our BRRRs, which will give them 8 months. I thought that we can't just leave it hanging, so we have to have time frames. So I'm proposing that we give them up to end of October. Is that acceptable, members?
Agreed, Chair.
Thank you. Thank you very much. 80.
Apologies, Chair. It's Wilma. Apologies for the interjection. I do agree with your proposal about the PSC. If you could just indicate where that is in the report.
Ms. Stone.
We have the finding at 14.2.2, and I think there's a recommendation later at the end of the document. So perhaps there we'll put the date. It might just be easier to insert it. Otherwise, I'll reflect something in 14.2.2.
Yes. It's just Honorable Nivo Drachams, I was reading it last night and I picked it up last night. I think Honorable, in fact, I think Ms. Silkstone will look for it in the document.
Yeah.
But I know I think it's under recommendations. We're on 84, 85. '86, 87, 88, 89, 90, 91, 'Thank you very much. Can I put, is there anyone who is going to move for the report to be adopted as corrected?
I so move, Chair.
Honorable Ngola Mos, is there any seconder?
Wilmani Odruchen seconds.
Honorable Nivo Dracham seconds. Any objections?
No objection, Chair, but the DA reserves its position.
The DA reserves
Chair, the EFF also reserves its position at this moment.
the DA, the
And
EFF.
the ACDP, thank you, Chair. Please also reserve the position of the ACDP. Thank you.
Thank you. The report is adopted. Let's go to the next report, the Office of the Chief Justice. Can you put the slide? Can you put up the slide?
Oh, sorry. Sorry, I'm almost there.
The budgetary review and recommendation report of the Portfolio Committee on Justice and Correctional Services dated 19 February 2021. The Portfolio Committee, and Ms. Silkstone, can you go up? The Portfolio Committee on Justice and Correctional Services have considered the financial and non-financial performance information of the Office of the Chief Justice and Judicial Administration for the year ending 31st March 2020 and first quarter of 2020-2021 reports as follows. Are there any corrections on page 1? Page 2? Page 3? Page 4? Page 5? Page 6? Page 7? Page 8? Page 9? Page 10? Page 11? Page 12? Can you deal with the sub-program?
Yes.
Page 12? Page 13? Page 14? Page 15? Page 15. Page 16.
Sorry, Chairperson.
Honorable Mufokeng.
On 10.1, the committee once more express unhappiness. I think Honorable Swart expressed that, and can we change it, please? Thank you.
Okay, page 14, page 15. Page 16. Page 17. Is there a mover for the adoption of the report as corrected?
I move, Chairperson.
Honorable Mufokeng moves. Is there any
And I
second?
support, Chair. A
Honorable,
second. Yes, okay.
Honorable Jailer seconds. Is there any objection?
Chair, will you please note the DA reserving its position?
The DA reserves its position.
And the ACDP, thank you, Chair.
The ACDP. The report is adopted. Can
Chair,
you, Honorable Horn?
before we go to the next item, will you just allow me, and I'm sure other colleagues will join in, to express a word of thanks to all of the committee's staff members or officials, or really those who carry us, for all of the hard work put into these BRRR reports, specifically in difficult circumstances where there was disruptions in the program. So I expect it was even more difficult than in other years for them to complete these drafts for us to deal with. And I think we owe them a word of thanks.
Thank you very much, Honorable Horn. I think you are really speaking on behalf of all of us. It was an unusual year, and they produce really outstanding work under very difficult conditions. We really do appreciate your work, your dedication, your professionalism, and your competence. I think Honorable Horn has spoken on behalf of all of us. Thank you very much.
Thank you. We agree.
Thank you very much. Thank you. Let's go quickly to the minutes. We are already 8 minutes above the time we had allocated ourselves. Committee Secretary. We are dealing with the minutes of the 16th of February, 2021. Are there any corrections on page 1? Page 2?
Chair.
Honorable Swart.
On page 2, can we just go back? There was a bullet there that at the page 2, the bottom. I know there was an issue there. I've lost my reference, but it was the sense that spoke about the lack of proper management and financial fraud and corruption. Yeah, at that, yes, the last sentence. Financial resources have been strained because of a lack of proper management, budgetary cuts are largely, we must insert budgetary cuts as well. I'm not sure actually whether that was referred by members, but it's very clear that one of the reasons is budgetary cuts as well. Otherwise, it doesn't proper capture the reasons. I would just insert budgetary cuts. Budgetary cuts, ARY, and sorry, that's all. Thank you, Chair.
Okay. Page 2, page 3. Page 4. Is there a mover for the adoption of the agenda as the minutes as corrected?
Steve Swart moves, Chair.
Honorable Swart moves. Is there any seconder?
I second, Chair.
Honorable Mfukeng seconds. Committee Secretary, the next set of minutes. Thank you very much. The draft minutes of the Portfolio Committee on Justice and Correctional Services, dated 17 February 2021, deliberation on criminal matters and related amendment bill, adoption of the committee report on Correctional Services Amendment Bill. Are there any corrections on page 1? Page 2. Page 3. Is there a mover for the adoption of the minutes?
I move, Chairperson, for the adoption of the minutes.
Honorable
I second.
Maseko
Swart
move.
second.
Honorable Swart seconds. The minutes are adopted. I think the matters arising from the minutes, it was the issue of the program, which I've already reported on, and that we will report on Wednesday about the program. And the letter to the minister is, I am signing it off today. The committee secretariat have already written the letter to the minister, and I'm signing it off today. So thank you very much, members, for your attendance, for your diligence, for your hard work. And thank you to everybody who was part of this meeting. Thank you very much. We have taken a lot of time from Correctional Services Subcommittee. I will now hand over to the subcommittee. Thank you very much. This part of the meeting is adjourned.
Thank you very much, Chairperson. I think now we can start on the Subcommittee of Correctional Services. We've noted the apology of Honorable Richard Janji, and I would like to welcome the Deputy Minister and the officials in the department and the Commissioner. I would hand over first to the leading person, who's the Deputy Minister, to take us. We are now on the update on COVID-19 in correctional centers and measures put in place under level 3, including vaccination program. Can we allow you to open before we have the slides on?
Thank you, Chairperson. Honorable Chairperson, members of the Portfolio Committee, DCS members, members of the media, good morning. We would like to thank the Portfolio Committee for giving us the opportunity to brief its members and the public on COVID-19 measures put in place under level 3 by the Department of Correctional Services, as well as the COVID-19 vaccination plan. Since the beginning of the COVID-19 pandemic in December 2019, the global health community continues to grapple with the effects of the COVID-19 pandemic, which negatively affects health systems, the economy, and overall well-being of citizens. It is critical that all individuals continue with strict adherence to the interventions and protocols put in place by government, which include physical distancing, wearing of face masks, and frequent washing of hands with soap and water, or regular sanitation of hands in order to minimize the spread of COVID-19. Although the country has started seeing a decrease in the new COVID-19 cases after a vicious second wave, scientists caution that a third and even fourth wave is looming. In managing this pandemic in our correctional centers, the Department of Correctional Services developed the standard operating procedures known as SOPs for preparedness, detection, and response to COVID-19. These SOPs provide guidance on mitigation strategies that must be implemented to prevent, detect, and respond to COVID-19 in DCS facilities. The SOPs are reviewed as required to incorporate new developments on the COVID-19 pandemic. It should be noted that DCS has in place version 3 of the SOPs. This means that the SOPs are aligned to government category of levels for lockdown. However, Chairperson, it should be noted that the presentation submitted by the Portfolio Committee to the Portfolio Committee had the statistics dating 31 January 2021. The COVID-19 reported cases of officials in the department at the time were 6,850, which accounted for 0.47%, and inmates were at 3,776, which accounted for 0.26% of the South African COVID-19 positive case load. In the past 17 days, the numbers of COVID-19 cases of officials are now more in the Western Cape, followed by Gauteng, Eastern Cape, and KwaZulu-Natal. In the Western Cape and Gauteng provinces, the numbers of COVID-19 positive officials increased by 23 and 22 cases respectively between 31 January 2021 and 17 February 2021. The Eastern Cape increased by 7 cases and KZN by 15 cases in that time period. The numbers of COVID-19 positive cases for inmates are more in the Eastern Cape, followed by the Western Cape, Gauteng, and the KZN. The numbers of COVID-19 positive inmates in the Eastern Cape increased by 12, in the Western Cape by 4, in Gauteng by 73, and in KZN by 6. The first COVID-19 infection in DCS facilities was detected in April 2020 in the Eastern Cape. We continue to see the number of positive cases of COVID-19 increasing in our facilities. In addition, the new variant 501Y.V2 was also first detected in the Eastern Cape. The high number of increase in Gauteng province may be attributed to people going back to work or going back home after the festive season. The department continues to implement the non-pharmaceutical measures of infection prevention and control in order to curb the spread of infections. Now, the COVID-19 related deaths were 860 officials, as I said, at 31 January 2021, which accounted for 0.36%, and inmates were 62, which accounted for 0.14% of the South African COVID-19 related deaths. The relatively low death rate is attributed to the various strategies implemented in the department to mitigate the impact of COVID-19 within our facilities. The measures that were put in place under level 3 include limitations in movement in and out of the centers in order to comply with the infection prevention and control measures. Non-pharmaceutical measures of IPC like social distancing, hand hygiene, and wearing of masks were adhered to. However, there were challenges encountered with respect to overcrowding in some of the centers, those transported from court to our centers in conditions where it was impossible to comply with the non-pharmaceutical measures of infection prevention and control. The department has liaised with the South African Police Service to ensure that those in transit to DCS facilities adhere to the wearing of masks protocol. Some of the prevention of infection measures included suspension of visits by members of the public and legal representatives, except for essential and permitted service providers as provided for in the regulations. Monitoring of compliance by high-risk parolees and probationers took place in collaboration with SEPS and SANDF where it was deemed necessary. Low-risk categories continue to be monitored telephonically. With regard to remand detainees, the payment of bail money was processed through the courts. DCS COVID-19 vaccination rollout plan. On acquisition of the COVID-19 vaccine, with regards to the vaccination rollout plan, the Department of Health will be the sole purchaser of vaccines for the country. The Department of Health is providing guidance in terms of procurement of services to be provided during the rollout period. Given the limited availability of vaccines around the world, it is important that our engagements with the health department remain cordial in order to ensure that vaccines arrive on time at DCS facilities and coordination of assistance is also in place as required. On phases of vaccination in DCS and inclusion of officials and inmates, as per the planned approach announced by President, there are 3 phases for the rollout of the vaccination program. The National Commissioner and management have engaged with the Department of Health officials to consider DCS officials on phase 1 and not only on phase 2, as communicated by the President. This inclusion of DCS frontline workers in phase 1 is based on the fact that the department is functioning in a unique environment where officials are frontline workers at the cold phase of service delivery as determined by the COVID-19 vaccination rollout strategy. The critical workforce is in constant contact with the public and those that are entrusted in our care, placing us at the same risk level as healthcare workers. A response in this regard is still awaited. The Department of Health, however, has been given the green light such that during phase 1, all health sector workers in DCS will be vaccinated. On phase 2, essential workers, persons in congregate settings, persons over 60 years of age, persons under 18 years of age with commodities and inmates will form part of this group to be vaccinated during phase 2. On pregnant women and babies are not part of the vaccination program. They were not part of the vaccination trials, and the effect of the vaccine on them is not known. This is based on the information from the Department of Health. In conclusion, Comrade Chairperson, remand detainees will be vaccinated in DCS depending on the type of vaccine available. For instance, those who will be vaccinated with the Johnson & Johnson vaccine will be given only 1 dose. On the other hand, remand detainees with court dates that are due at the time of vaccination and who will be vaccinated with other types of vaccine requiring 2 doses will be referred to the Department of Health vaccination program in order for them to be monitored by community healthcare workers. Thank you, Chairperson, honorable members. I'm happy now to hand over to the National Commissioner and his team to take any questions the committee may have or present the full presentation should the committee so wish. It is my understanding, though, that the full presentation has been with the honorable members for some time now. Thank you.
Thank you very much, Honorable DM. We are going to allow the Commissioner and the team to make a presentation so that the members can move with it. Over to you, Commissioner, and the officials.
Thank you, Honorable Chair and honorable members. Chair, the DM has really done the entire presentation because we'll be repeating what the DM has said, Chair. So we'll do it if you direct, but I really think the DM has captured the entire presentation. So we are ready to field questions if you are agreeable to that, Chair.
Commissioner, it's not for me. Let me check with the members. Members, are you saying that you want to go straight to the questions or the presentation should be flighted and go through? Can I hear from the members?
I think we can go straight through to the questions, Chair.
Yeah, I also think that if it's going to be a duplication, then we would rather just go straight through.
Thank you, Honorable Self and Honorable Yaku, and we'll go in that way. Can I now look at the hands? I noted Honorable Self. Is there any other one? Thank you, Honorable Self.
Yes,
And myself, Chair.
Okay.
Sorry.
Got Honorable Nivold, Honorable Matemba. In that order.
Thank you very much, Chairperson. The Deputy Minister has covered some of the issues that I had problems with. But let me say at the outset that I agree that officials in the department should be regarded as being frontline workers and should be prioritized for vaccination because they really are on the front lines. But I'd like to know a little bit more about quarantine and isolation in crowded facilities. How does that actually work, particularly remand detainees that are brought into the facility from court say, and those remand facilities by and large are very overcrowded. Is it possible to have isolation for 14 days? Because it doesn't seem to be feasible in some of the facilities at least. And secondly, I know that visits by members of the public and by legal professionals have been suspended. They have been suspended, I assume, now for the most part of the year. What are the implications for the administration of justice of the fact that particularly further charged prisoners are not able to confer with their legal representatives? What is the implication and how does one mitigate that, that risk? Thank you, Chairperson.
Thank you, Honorable Self. Honorable Nivo Drahan, then followed by Honorable Nomatemba Masekojele.
Thank you, Chairperson. Thank you, Honorable Deputy Minister, for your presentation. My question, my network isn't so good today, but while the Deputy Minister was presenting, I wanted to know the medical staff within correctional services. They should be considered as the first phase, for the first phase of the vaccination. So I wanted to know, in all centres across South Africa where medical staff are present, will they be the first in line to get the vaccine? And then the community centres, the community corrections, will they be able to monitor and prepare and monitor for parolees during this time? Thank you. That's my question, Chair.
Thank you. Honorable Nomatemba.
Thank you, Chair. Thank you, Chairperson. I think, thank you, Deputy Minister, for the presentation. And I think I agree with you. Our officials should be on the front line. They must be vaccinated with the first group. But now my question is on the issue of overcrowding, Deputy Minister. I just want to find out. I'm sure I'm not going to put you on the spot with this question. It is about the issue of overcrowding. Recently there has been some arrest at the borders that the Minister of Home Affairs alluded to on TV. So I just wanted to find out, with those arrests, where are those people? Are they in our facilities, or have they been taken somewhere? That's my question. And I thank you, Chair, for that.
Thank you, Honorable Namathemba. I think the last question from my side will be, during the first wave of COVID-19, there were media reports that officials of the department were labeled both by the community and inmates as the carriers of the virus. I just want to know how the department assists officials to deal with the stigma. Thank you. Over to you, DM, and also the team that is with you, the commission.
Chairperson, so as not to put them out of work, I'll allow them to speak now, the officials.
Thank you very much. I think I will allow Honorable Commissioner, your team can follow it the way you prefer. Thank you.
Thank you, Chair. Mr. Mahela to respond to some of the questions. Then we'll get Ms. Mabe to respond to the health issues. And then Dr. Musomi on any of the issues that need to be covered further, and I will do.
Thank you, Commissioner. Thank you, Chairperson. I will deal with the issue of quarantine on admission of remand detainees. At each and every center, we make arrangements for newly admitted remandees to be put in a separate location for a period of 14 days for observation. And if there are people that are being detected having symptoms during that period, they will then be moved to dedicated isolation sites that are also established in each region and in most of the biggest management areas. In areas where they are infected offenders or remandees, and there is no isolation or quarantine space, we follow the protocols and they are moved to the identified sites in the region or in the management area. Thank you.
Thank you very much to the Honorable Chair and the Honorable Member. With regards to the issue of stigmatization of officials and inmates, in the department, we do training and awareness of how the COVID-19 manifests and how the infection can be prevented, as well as those that are infected. They are also educated and awareness created on how to follow the relevant protocol with regards to the quarantine and isolation side, as well as psychosocial support done on inmates. Because if the officials themselves understand how the disease manifests and is prevented, hence they will also be able to further take the information to the community with regards to destigmatization. So that is how we deal with it internally in the department. Thanks, Chair.
Thank you, Chairperson. I'm not sure if any of my other colleagues that is on the platform want to respond before I do. I don't know if there's an indication of anyone. If there's not, Chair, on the issue of community corrections, what we do is that we monitor, we deal with our IPC compliance and controls when we deal with community corrections and parolees, so that we're able to track and monitor those individuals, Chair. On the issue of overcrowding, I think it remains a challenge, especially in our remand areas. But it has been managed because of some of the actions that are taken both by heads of centres, where they look at engage the court to allow individuals to be diverted. On the issue of the foreigners that have been arrested at the border post, as indicated by the Minister of Home Affairs, I can indicate that there has been no indication that those people have directly moved to our centres. So I'd assume that they had gone to Landela, where they are at our centres. We will be processing them and keeping them separately from the general population. On the issue of legal representation, the courts has been operating for a considerable period. What I can indicate that we have ensured that inmates are able to engage with their legal representatives telephonically, and that has been the means of communication. Chairperson, I'm hoping that we have dealt with the questions that have been posed. Thank you, Chair.
Thank you very much. Can you, maybe I will check on the members if they have additional questions. I can see that Nivo Drachen, Honorable, is there. I want to check on the department, maybe your readiness in terms of vaccination program. And the other one, it will be how much did you spend so far in terms of the PPEs? And then Honorable Velma Nivo Drachen, can you take your question?
Sorry, the interpreter's voice is not coming through.
The interpreter's here. We're going to hold. Please hold. There's a technical problem. My voice was off. Okay, technical problem has been resolved. I have missed the answer regarding to the medical services or the medical professionals in your centers, but I would like to add that in your slide 19 of your presentation, the vaccination rollout, there are three categories of medical professionals. So currently the vaccines are available for medical professionals to be vaccinated. And we have your totals here in your presentation. What I would like to know is that within each province, in each facility, during this week, the medical professionals who are being vaccinated throughout the provinces, frontline workers, are any of your correctional services medical professionals included in the current vaccine rollout? And then the mitigating strategy that you have in your presentation, the handling of babies to the age of 2 years old, if the mother has contracted COVID, I'm curious that if it has happened that any mother has contracted COVID and their baby is under the age of 2 years old, if that has happened, what are the measures that you have taken? Thank you very much, Chair.
Thank you, Honourable Velma. Over to you, Commissioner, and your team.
Chairperson, my apologies before we get the response.
Okay, you're welcome.
I just want to find out from the Commissioner, up to this far, with all the report that you have received, how many deaths have we incurred within this period since December up to now? Or maybe how many deaths? Let me just put it like that, maybe because they don't have numbers exactly, but have we had any death recently?
Thank you. Is there any other honourable member who wants to add or ask a question? I think it's okay. Then you can take over, Commissioner, and your team.
Thank you, Chair. We'll just start with the CFO on the PP costs, and then we'll go to CFO.
Good morning, Honorable Chairperson and members. With respect to the cost on COVID-19, there is different items that we have incurred. We've appointed nurses on contract. Up to January, we had spent 86.3 million relating to the contract workers for nurses. On goods and services, we spent 206 million on various items relating to medical supplies, clothing material in the main, and that is 206 million. On machinery and equipment, we spent 4.7 million. So in total, we've spent 296 million up until January 2021. Thank you, Chair.
Thank you.
Thank you, Chair. Ms. Marvin.
Thank you very much, Chairperson, Honorable Chair and Honorable Member. With regards to the readiness of the Department on vaccination, the Department of Correctional Services categorized the healthcare workers who will be in phase 1 of the vaccination program and will be vaccinating at the designated vaccination site of the National Department of Health. And this also answers the question that for the medical professionals in DCS, are they covered under the Department of Health rollout program? Yes, they are covered, and they are in the first phase, and the medical professionals have also registered on the Department of Health system for vaccination. That will ensure that they are able to be monitored with regards to the vaccination program. Internally in the department, we also have a vaccination coordinating committee that looks into the preparation for the phase 2 of the inmate vaccination. So the answer is we are covered. With regards to babies that are with their incarcerated mothers, we do keep babies up to the age of 2, where then after they are referred to the family member, and it is for the issue of the babies to bond with the mother. So if the mother is infected in DCS, we do have nurses and social workers who will take over the care of the baby as the mother is still in isolation or in quarantine, as the case may be, and thereafter the baby will safely be reunited with the mother, and it's only for the sole purpose of ensuring that the baby does not become infected. However, the baby is well cared for in that time period. With regards to the death, the question on the death in DCS, we do have COVID-19 deaths in DCS, and as per the presentation that was sent to the committee, as at the 31st of January, the number of inmates who succumbed to the COVID-19 infection by then were 62. And the officials who succumbed to the COVID-19 infection as at that day were 160. And as of today, the number of inmates is now at 66. Thank you, Chair.
Thank you, Chairperson.
Thank you very much, Chair Commissioner. I think the questions, the answers have been exhausted. Is there any member who wants to make a follow-up or who's not satisfied with any other question that you feel that is not answered? I think all is well. Can I give over to the DM? And let me first, DM, allow the Commissioner before you, and then you will close. Commissioner?
Thank you, Chairperson, honorable members. Just 2 points I want to make, Chair, is that during this period and going forward, we will remain vulnerable, especially because of the movement of our remandee population. So we remain vulnerable. We have engaged with the clusters at a local level, provincial and national level to assist us in complying with the COVID protocols to ensure that we can maintain the integrity of the offenders that move through those spaces. The other part that where we are vulnerable is with our officials, because they live in society, and we are therefore ensuring that there's heightened awareness so that we are able to insulate our population in our facilities. Chair, I also want to indicate Ms. Marpe had given the stats, but we will provide the stats after the session to the honorable members on cases up until the 17th. Thank you, Chairperson.
Thank you very much. Honorable DM?
Well, thank you very much, Chairperson, honorable members. Well, we appreciate the support we have received from the committee in this meeting, particularly regarding the need for our officials to be considered to be essential workers deserving of being a part of the first phase, because as we understand, they commute between our centers and our communities. And if they happen to contract it in our centers, they take it to their communities and vice versa. So it's important, therefore, that they be defended in terms of contracting this virus wherever they are. So we appreciate that. And lastly, even though, Chairperson, we appreciate the fact that the numbers of deaths as a result of COVID-19 in our centers, both in respect of inmates and officials, are not increasing as they used to before. But it is our wish that no official, no inmate passes away in our centers because of this disease. That is why we are very much keen on ensuring that the preventative measures, the non-pharmaceutical measures, are always adhered to. We try social distancing, difficult as it is because of our overcrowded conditions. we try to ensure that they do have sanitizers, especially the inmates, and that, there's putting on of masks at all times. So we try our best, and we appreciate the support, as I say, that we are getting from the department. I did get worried when I read in one of the papers, Honorable Self, something about you complaining that it's not proper that our officials must be given this preference that is to be attended to in the first phase of the vaccination program. I'm happy to learn it from yourself now that no, that is not your position or that of the party, that you support the request for our officials to be included in the first phase. Thank you very much.
Thank you very much.
Chairperson.
As the Honorable Self, thank you very much.
I wish to emphasize the statement that I issued very definitely emphasized that officials of the department needed to be vaccinated as part of the first phase.
Must be the newspapers that I read. As I say, I'm very happy to learn from you that you are in sync with us in that regard. Thank you.
Thank you very much. You heard it from the horse's mouth. Thank you very much, Honorable Self, Honorable Deputy Minister, Commissioner, and your officials. I would like to thank you, and I would like to thank all the members of the committee, honorable members, for their deliberations and all the work that has been done today. We wish you well, and I think we've come to the end of our meeting. In the absence of any other thing, the meeting is adjourned. Thank you.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.